let's talk about the origins and the composition of the cranial nerves. So basically, these are the functional components of the cranial nerves. But today we're just going to talk about the 5, 7, 9, and 10 cranial nerves. So 5 and 7 are going to arise from the mesencephalon, and 9 and 10 are going to arise from the myelencephalon. Like, they are all parts of the hindbrain. Let's talk about the trigeminal nerve. It has two functional components. One is the GSA and the other is the SBE. GSA arises from the trigeminal ganglion. SBE arises from the brachio motor. So the general somatic afferent is basically the sensory component, and it is going to supply to the skin, mouth, facial muscles, teeth, anterior 2/3 of the tongue. And the special visceral efferent is for the facial senses. So here, what is the special sense? It is the chewing sense. So it is going to supply to the muscles of mastication, the mylohyoid, the tensor villi palatini, tensor tympani, and the anterior belly of the digastric. The mnemonic for this is MMTTD. Now let's talk about the 7th cranial nerve, which is the facial nerve. So it has 4 functional components. First of all, please remember GSA, SVE as we remembered before. And also remember SA and GVE. All right, SA is the special afferent or the genicular ganglion. So special afferent is going to supply the taste or the anterior 2/3 of the tongue. Now let's imagine a scenario. For example, there's a girl who is eating a pizza. Okay, so first of all, she is going to taste it, and then someone tickles her on the ear. So what is going to happen? GSA is going to be used. And what are the areas innervated by GSA? Those are the skin, external auditory meatus, and then 2/3 of the tongue. So please just remember the external auditory meatus here because she's tickled on the ear. And then SVE, she makes a face as to the person who was tickling her. So facial expression muscles, stapedius, stylohyoid, and also posterior belly of digastric if you wanna. Let's talk about the GVE, that she starts to cry. Lacrimal glands were activated, submandibular and sublingual glands as well. Now let's talk about the 9th cranial nerve or the glossopharyngeal nerve. It has the same components as before. So first of all, we have SA, then we have GSA, SVE, as I told you before, and the additional components are GVA and GVE. Okay, so if you want to remember the derivatives, then okay, you can. The special afferent is always for the special senses. So here we have the taste sense. Posterior 1/3 of the tongue is going to be supplied. For example, some person is eating a pizza and it goes towards the posterior 1/3 of the tongue, like for swallowing. And then what happens? General visceral afferent, someone tickles them, so middle ear. And then happens GSA happens, like someone tickles them, external ear, GSA. And then SVE. What is SVE for? It is for digestion. So stylopharyngeus is a muscle of the pharynx. The remaining ones are GVA and GVE. So please remember the parotid gland for both of them. And for GVA, you can also remember MC, which are middle ear and carotid body. Now let's talk about the 10th cranial nerve, and it also comes from myelencephalon. It has the same components as the glossopharyngeal nerve: GVA, GVE, SA, GSA, and SVE. So first of all, let's talk about the SA component, which is just for the taste. So what are the muscles used for that? Palate and epiglottis. Okay, please remember that. So now let's talk about the GSA. GSA, as I told you before, GSA is always for the tickling. Here the GSA is what's going to supply the base of the tongue, external auditory meatus. Now let's talk about SVE. SVE for 9 and 10 are always for digestion. The muscles of the pharynx, constricting muscles of pharynx, intrinsic muscles of pharynx, and superior 2/3 of the esophagus was used here, as well as GSA and GVA and GVE are left now. So for the GVA, please remember the trachea, the bronchi and digestive tract, and heart. And you can remember the same for GVE as well. So digestive muscles.